Good morning, I'm Stefano Francesco Crinò, medical doctor at Digestive Endoscopy Unit at the Pancreas Institute of Verona in Italy. On behalf of my co-authors, I would like to thank Endoscopy for the possibility to share our article entitled Wet Suction versus Low Pool Technique for Endoscopic Ultrasound-Guided Fine Needle Biopsy, a multicenter randomized crossover trial. The majority of studies published so far investigating the sampling technique for US-guided biopsy were performed using fine needle aspiration and demonstrated that slow pool improved the blood contamination of samples compared with standard suction, and also demonstrated that wet suction outperformed standard suction in terms of adequacy and accuracy. However, little is known about the performance of such techniques during USFNB. Therefore, we performed a randomized crossover trial comparing the slow pool and the wet suction during USFNB of solid lesions. We included consecutive patients with solid lesions larger than 1 centimeter, and we performed 4 needle passes using a 22-gauge fork-tip or Francine tip needle, alternating the sampling technique in a randomized order. The primary aim was the histologic yield, defined as the rate of samples containing an intact piece of tissue of at least 550 micron. Secondary endpoints were the sample quality in terms of tissue integrity and blood contamination that was evaluated by applying a score as reported in this table. Other endpoints were also diagnostic accuracy and the rate of samples containing an adequate tumor fraction. In this figure is reported the flowchart of the study. As you can see, we randomized 220 patients and we finally analyzed 210 samples collected using the wet suction and 210 samples collected using the slow pool. There were 146 pancreatic and 64 non-pancreatic lesions. Overall, a tissue core was retrieved in 150 cases using the wet suction and in 129 using slow pool, with a statistically significant difference. The main tissue integrity score also was higher using the wet suction. On the other hand, a higher blood contamination was observed in the wet suction samples, both considering the overall population and the subgroups of pancreatic and non-pancreatic lesions. The diagnostic accuracy and also the tumor fraction did not significantly differ between the compared techniques. So in conclusion, the wet suction techniques in USFNB allows a higher tissue core rate procurement compared with slow pool. The diagnostic accuracy and the rate of samples with adequate tumor fraction were slightly higher using the wet suction, but no statistically significant difference between the two techniques was observed. So please enjoy reading the full article in Endoscopy, and thank you very much for your attention.